last night, and I hope you enjoy the next 2 days. It's full of science. It's an honor and a privilege to introduce our first speaker. Johanna Ralston, as everyone knows, is the CEO of the World Obesity Federation and has been since 2017. She's led it to take in such a short. There are issues with the microphone. It's not a problem for me, but it's a problem for the speaker. Please come out. Johanna is an alumni of Harvard Business School, where she studied public health at Johns Hopkins. She has been on many WHO boards for non-communicable diseases. Prior to leading the World Obesity Federation, she led the World Heart Foundation, and there's no one better to speak with us about obesity, a worldwide burden that we cannot ignore. Thank you very much for coming, Johanna, and for the talk.
Hello, good morning, salam alaikum. It is a great pleasure to be here with you. I'm going to just put down my glass of water. Okay, I will speak with the microphone like this. Thank you. I am Johanna Ralston, and thank you so much for your kind introduction. And thank you to our dear friends here in Abu Dhabi and the UAE, where we've been working for a number of years with you, and we are very pleased to be here at the 6th UAE meeting on obesity. And we think the introduction of a new coordinated effort in the region that we're very proud to be part of. I love coming back to this part of the world. When I was with the World Heart Federation, we held a congress in the Dubai Congress Center, and I've also been at sessions at ADNEC, your wonderful Congress Center that you have here in Abu Dhabi. So we have worked a great deal with various stakeholders in the UAE around addressing non-communicable diseases, and now especially the challenge of obesity. Let's see. Okay. A few things. First of all, the World Obesity Federation. I've been honored to be the CEO of the World Obesity Federation since 2017. And we are a membership organization working with obesity organizations around the world. We have organizations that are members in 103 countries, which speaks to how broad and wide the obesity challenge is all over the world. Some of these are diabetes organizations, some of them are hospitals, some of them are like ADPHC, the public health partner on obesity in a country led by government, and some are more patient-facing. Others work in campaigning. We have some heart foundations that have become members because they are experiencing so many challenges associated with obesity. So we have members representing the entire community of obesity challenges and working together, but all rooted in evidence and science. We have a clinical care committee, and you'll actually hear from three members of our clinical care committee over the next few days, so thank you for that. And we have policy and prevention committees to help us guide our work. I'm going to talk to you a bit today about the obesity epidemic, the global challenge, some reasons for why that might be, why there is a global challenge, and then going into some of our work and some of the wider agenda around the World Health Organization in addressing obesity around the world. So first of all, though, I'm going to ask you a question that I would like you to think about over the next few slides. The question is, what do you think is the end of this sentence? This was written 13 years ago by Professor Harry Rudder at the University of Bath in the UK. He said, the single most important intervention to tackle obesity is. And I would like you to think about what is the single most important intervention in your views to tackle obesity. Okay, so that is a question that I want you to be asking yourself. You may already feel you have an answer, Perhaps it's possible that when he wrote this in 2012, we had much different data than we do now, and perhaps things have changed and there is a different answer to this question. But it's a question I would like you to consider as we go through some of what we're talking about here. And what we're talking about here is that obesity rates have risen rapidly in every part of the world. So in 1990, we had 226 people living with obesity. By 2022, new numbers from the Lancet, and it's the NC Risk Collaboration Center out of Imperial in London, came up with that there's now a billion people. World Obesity Federation has been hosting the Global Obesity Observatory for many years. It's really the gold standard on measured data and estimated data on obesity. The person who runs our observatory has been working with World Obesity Federation for 25 years, long before obesity was really well understood as a widespread challenge. So almost in that time, since Rachel on our team has been working at World Obesity Federation, rates have quadrupled. And now we're looking at, in just a decade, we anticipate that they'll double again. Now this seems a bit counterintuitive because we walk out here in the exhibition area, we have amazing companies doing incredible work. And so that is part of this is we can influence some of this trajectory. But much of it is already underway. We have children with obesity who are growing into adults with obesity. We have people living with obesity in places where there's no options. We have many, many people in many parts of the world living with obesity and living in health systems that do not address it or recognize it or understand it. Here in the UAE and in some of the other countries that are gathered here, we have been working with what we call the MENA region, the Middle East North Africa region. And there are many countries with rising obesity rates, many well-trained professionals trying to address it, but different understanding in different governments in terms of what that means. So what are some of these? What does this look like? So if we take it a little bit further, over the next decade, we're going to have nearly 2 billion people living with obesity, and these are fairly conservative estimates. We try to be conservative in our work in terms of when we make bold statements about obesity. One of the interesting experiences is we publish the World Obesity Atlas every year on World Obesity Day, and each year we manage to surprise ourselves with the information that is sitting there in our own data in terms of another alarming statistic about obesity. So I think I want to communicate that this is an incredibly serious challenge. It is made more serious by the fact that it has been poorly understood as a disease, and it has been poorly resourced and prioritized. Many, many countries do not do anything about obesity, so it's extraordinarily important in this part of the world and here today that we can find ways to counter that, to come together to ensure there's greater prioritization. You're very fortunate, and I know in the UAE, in Abu Dhabi and in Sharjah and in Dubai and other emirates here, you have government that is focusing on this. They are aware of this. They are taking bold action, and we need to do more. So we're very pleased to be working here with a government that understands how serious this challenge is, and we hope it can be a model for the rest of the world of how do you effectively address obesity. But again, these numbers are very frightening, and we're talking about also that childhood obesity rates could double over the next decade. We have some promising statistics in under fives where there's been some stabilizing of the rates, but rates have not been going down except in very small geographies. So we are looking at a challenge that continues to grow. There is no shortage of work in terms of what needs to be done here. So I'm going to tell you a little bit about the global agenda. if you've heard me speak before, you know I'm actually very passionate about the United Nations and the World Health Organization as institutions that can help to set common targets that we can all work towards together. And actually, so in 2012, I believe it was, the World Health Organization, through the World Health Assembly, its governing body, set a target of 0 increase in prevalence of obesity to 2025. So 0 increase using 2010 numbers. They set targets for other non-communicable diseases at the same time. They set targets around reductions in physical inactivity, increase in access to treatment for cardiovascular disease, reductions in tobacco, and various other risk factors and drivers of disease and management and treatment of diseases. But the obesity target was 0 increase in prevalence to 2025. Now, do you sense a slight disconnect between that and between the previous slide where I just said that we are looking at a doubling of the rates? It was a wonderful target. At the time, I think there was also a belief that if we did what Professor Arya Sharma calls eat less and move more, if we just address nutrition and physical activity, we will reduce obesity. And in fact, that did not happen. When we at the World Obesity Federation did an analysis about a year ago of how we were doing on that 2025 target, were we going to have a 0 increase in prevalence between 2010 and 2025? The answer is very much no. We have a doubling of obesity in that time. So you could say 100% increase almost. So that was a very, not surprising, but that confirmed what we knew, which is that even though there have been many efforts to address obesity, just doing it through nutrition and physical activity is not enough. There needs to be much more, and it needs to be understood and treated as a disease. As part of the Sustainable Development Goals, which you are probably familiar with, these are global goals that were approved in 2015. We also had, there was a target to reduce premature mortality from non-communicable diseases by 1/3 to 2030. We now believe that one of the main reasons that that target is being missed, and it is being missed, is because of the continued failure to address overweight and obesity. Obesity is also an indicator within the SDGs. And there has been sort of a stretch goal of saying, well, if we don't reach flattening of obesity in 2025, we will in 2030. We just know that these global targets have been very catastrophically off target, and that there's clearly we've not been doing enough, and we haven't been doing all of the right things that need to be done to effectively address obesity. Another key point is and this is kind of part of the why is this happening and how is this happening? There has been a perception that you may have heard of obesity being only in in countries, in very developed countries, North America, Europe. The rates only being really, it's a rich country and a rich person problem. We know, in fact, at the individual level, obesity is increasingly associated with lower socioeconomic status, but also that in terms of sheer numbers of people living with obesity, it's 90% in low and middle income countries. So China, these are numbers, projections for the next 10 years, but the current list is approximately still the same in terms of the top countries for people living with obesity. It's China, it's India, it's the only country that is considered a high-income country here is the United States. So that tells us that this has really been a transition, and yet there's still many misperceptions about who is being most deeply affected by obesity. You can see again, I mean, Egypt is one of the countries in this region, and then in this area, Nigeria, very, very wide across all continents. So this tells us that the game has changed quite a bit since we started measuring this data. So in 2020, the World Obesity Federation and our friends from the European Association for the Study of Obesity and a number of other organizations decided, let's have one single day to work on obesity, rather than having you have your obesity week here and we'll have an obesity month there and different days and a fragmented response. We were very, very pleased to be able to come together and decide that March 4 each year is World Obesity Day. As part of this, we wanted to find a way of communicating visually why our understanding of obesity has been limited, and in fact that obesity again has greater complexity than has been previously understood. I'm going back to that first question I asked you. What is the single intervention? Well, here all of a sudden we're looking at causes. What is the single cause of obesity is another question. And I think if there are people who believe it's just, too much fast food or too much, this or that, or not enough sidewalks, which is fair. Those are all certainly contributing, but it's not one thing. And that's really important. So we actually took the image of a tree with lots of roots and said that the roots of obesity are complex. Indeed, it's not only that different, and there are multiple roots. So we show here food, biology, genetic risk, sleep, mental health issues, marketing. Marketing of unhealthy products. If you've been to a small island developing state where there is very strong and aggressive marketing, that can really play a factor and is helping to shape the childhood obesity challenge in particular. But these are all, and stigma has continued to play a role. And I think we'll hear more about stigma later today. But stigma doesn't just include medical professionals who've not received sufficient training. It can be even what we perceive sometimes as almost policymaker stigma, this idea that we just will focus on prevention and we'll solve the problem. Prevention is wonderful. Prevention is very important. Prevention is not enough for a disease that's affecting 1 billion people. So this multiple approach, this sense of trying to communicate the complexity that all of these roots are in a single tree or a single person. It can be all of these roots are in a single community. And therefore, perhaps the solutions also need to address multiple factors and not just one. So this image was really helpful, and I was very proud. One of our colleagues in Mexico said, this is actually how we now teach primary care about obesity, is we just show these roots and explain many roots, one cause. We're very honored to have His Excellency joining us today too, and I'm very pleased to see you. Okay, thank you. I'll continue, and then we'll look forward to hearing from you as well. It's truly an honor, and I've had the privilege of meeting His Excellency previously. You have wonderful leadership here around addressing obesity in a comprehensive way. I want to acknowledge that. So again, this may be a useful way sometimes if you need to describe to primary care or to others the different roots of obesity, that it's not just one or two things, multiple things. Here's another way of looking at it. We've done some analysis of global funding, global health priorities, so priorities that come together at that sort of WHO level. Issues like HIV, for example, pandemics, which is very familiar to many of us. What is the funding for that? Because funding is a very good proxy for political will. So if we look at the orange and the red on the left, we're showing in 2020, about 3/4 of all deaths were due to non-communicable diseases, a number of those driven by overweight and obesity. And yet and then everything else was the 1/4. But if we look at that funding, that official development assistance funding that also includes the Gates Foundation, other philanthropic funding, so that speaks to these as these are considered to be global health challenges. It's about 98% of funding still goes to communicable diseases and only about 2% to non-communicable diseases. Even more disturbing, and this is only a very, as they say, back of the envelope informal estimate on the right, you see that of the funding that goes to NCDs, and it's about a couple of $100 million a year, a teeny sliver goes to obesity. So obesity is still only being addressed in kind of the commercial sector or in somehow vaguely in prevention. It is completely underprioritized as a global health issue, and yet by our estimates it's driving around 4 to 5 million deaths per year. So again, here we are. This is not to be depressing, it's just to say this is where we're starting from. So we need to really, how do we address this and how do we explain this? A couple more little pieces of information. We've done a study called MAPS, which stands for Management and Advocacy for Providers, Patients, and Systems. But it was really looking at where does obesity sit in systems in different countries? So does it sit in the health system? Is it somewhere else? Is it anywhere as a priority at the country level? So the first MAP study that we did in 2019, I think it was published in 2021, or I'm looking at Junaid, who's one of the co-authors, looked at, so, what were some of the perceived barriers? A very interesting one that came up again and again was lack of training, and particularly healthcare professionals not receiving training and understanding what obesity was, not knowing what to do with the patient who presented with obesity in the health system. When I first took this job, I came to Abu Dhabi for other reasons, and I met with my friend Wael Al-Mamin, who I knew from cardiovascular days, and I said, well, who sees the person with obesity here in Abu Dhabi? And he said, well, the cardiologist often does, the endocrinologist, the primary care. It can come through different doors. There's no one door, and there's no one response to it, because there hadn't to date been a kind of guidelines and national response. That is changing here in Abu Dhabi, and that's been really wonderful testament to the political leadership here and the motivation around that. But there's just been not training and understanding how to address obesity. We are hosting a scope school on Monday. I believe it's full, but do let us know. Hopefully you can join that, and that helps provide some basic common information and language and knowledge on obesity as well. Other elements, barriers, included the obesogenic environment, which has to be addressed. The environment where there's insufficient places for physical activity, where unhealthy foods are the norm. I just learned in the US, I think that it's up to, among children, I believe it's 60% of their diet comes from ultra-processed foods. So you can see that this change is happening in lots of places. All of these have to be addressed. On the right-hand side, you also see, we did some analysis of, are there recommendations at the government level? Again, this is 2019, around obesity. Are there obesity treatment guidelines? And we had 34 countries, out of all countries, really only 34 countries with adequate data to respond to that question, of which 41% of the 34 countries, but that's not a lot, said yes, there's something. Many said yes or no, not even agreeing really, and in quite a few, about a third, said no. So we know that at best it's a very small percentage of countries have obesity management, any kind of obesity treatment or management guidelines in place. So just to go on, and then in the area of nutrition, obesity also has that same issue of not being at the top of the list. We have worked very hard to have the concept of obesity is also malnutrition in all its forms. But in the global malnutrition space, it's still often malnutrition to most people still means undernutrition. We're seeing some of the global agendas around obesity in the nutrition space. There's a big meeting in Paris, the Nutrition for Growth Summit, that'll happen next year. It always happens in the Olympic city, after the Olympics. We are hoping to try to influence that, but it's been an uphill battle. So again, obesity is everywhere and nowhere, as we say. So what is the matter? How do we address this? Back to that original question. Where does it sit? What is the answer? Is it a matter of food? Is it a matter of, is the one intervention food? Is it treatment? Is it changing the obesogenic environment? What do we think? Let's go back to that question I asked you. So if we look at this multifactorial disease and we say, the single most important intervention to tackle obesity is, and this is going to maybe be a little bit of a different answer, to understand there is no single most important. There's multiple factors working together, and those factors will differ by country. But the interventions need to include some elements of prevention and addressing the obesogenic environment. They absolutely need to include obesity's inclusion in the health system and obesity in primary care and on up through management. Different elements, but they are going to vary by country. So what I think we are recognizing is that there needs to be multiple factors working together, but it's going to be different by country. It's going to be different by individual sometimes, how it's addressed. If you've ever seen the Foresight map, which tried to look at what are all the drivers and the factors that are influencing obesity. This was created in the earlier part of this century in the UK around what is the map of different factors that contribute to the environment in which obesity takes place. And you can see it is not a simple linear model. It's lots of factors working together. One of the reasons we really enjoy working here, among other things, is because you need to work at the multi-sectoral level. You need to have different sectors working together. It's much easier when they are close to each other geographically, when you have a region where the agriculture and health and finance are all in the same place and better able to coordinate activities. So one of the other ways that we've seen, and we just wanted to, just a few more slides to describe this, what's going on, is that we've worked closely with the World Health Organization. We are the main partner to WHO on obesity. We have, we do a 3-year plan that is approved by their executive board. We worked very hard to have a series of obesity recommendations approved in 2022. And I think what's exciting about those is it really described obesity as a multifactorial, complex chronic disease, as well as a driver of other diseases. It's given a much more comprehensive approach. It's the document on the left. We worked on it with our members, and we were very pleased to get input from people all over the world. That was turned by WHO into an acceleration plan that they are working on and we are supporting around trying to implement these recommendations in different countries. There is now 32 frontrunner countries. The number keeps changing. And so and including a few countries here in this region that we're very, very pleased are also frontrunner countries. But this is a map for all countries. What are your priorities, and how can you work with the recommendations to enhance and implement those? So the WHO, this is a slide from WHO. They have 5 work streams to deliver on the plan. We also, at the time when this all came together, we formed the Global Obesity Coalition with WHO and UNICEF so that we could support and coordinate activities. Often I think it's less important that we receive lots of money and more that we don't waste money that we have by coordinating better, by bringing each other, working together. And so it's been a really wonderful experience to work with WHO and UNICEF on coordinating actions around the world. These are some of the front-runner countries. Here we have Saudi, Bahrain. We have a number of countries in the region that are front-runner countries. And so then I want to wind down and look to the future and say, working together, we are so pleased that there is a MENA association is launching, that we have a stronger and stronger network here in this region, and that we are based here in the UAE. We know that is a great place to be getting work done. We wanted to speak to just a couple of other elements that work together. So World Obesity Day, again, March 4th. When we decided to bring it together, we were able to harness so much power. Even though we're small organizations, we have so much reach because there is so much pent-up need and information and desire to act on obesity and to communicate about it. So we were able to deliver on economic impact data at the global level and increasingly at the country levels, showing that business as usual inaction on obesity is already costing us a global average of sort of over 2% of GDP, and that figure will also double in the coming decades if we don't do all the things that we need to do and can do together. So obesity is already having a huge economic impact. We were able to get those numbers out there and get great visibility for that. We were able to really elevate numbers of people visiting our observatory, numbers of data about children and the impact on them, and the reach through media around our messaging. So our observatory, again, more than 2 million visits a year now, and it's a great source of data. It's used by journalists, academics, and the general public, and we welcome your continued inputs into it. And then as World Obesity Federation, we have several new thematic areas that I just wanted to speak to briefly. One is that this idea of obesity and, which was our theme for World Obesity Day. What does that mean, obesity and? It means really obesity is not happening in a silo. It is happening, it's obesity and cardiovascular, obesity and diabetes, obesity and food, the food systems. And so we're really encouraging a horizontal approach where we have lots of different groups working together. We noted that in South Africa, they're really speaking to obesity and HIV, both in terms of people living with HIV and on treatment, experiencing higher rates of overweight and obesity, but also more important, almost a reminder that the way HIV was positioned 30 years ago, which was heavily stigmatized, poorly understood, and there was a view that treatment would only be available for the select few, that is what they believe in South Africa we're now seeing with obesity. We would agree with that, and it's a really important piece. We need to map and fill gaps. We need to have better understanding of the disease, of the data, of the opportunities and priorities of different regions. We'll be doing a MAPS-2 study. Multisectoral action is key. The solution to fragmentation is multisectoral action. It's not exciting, but it's incredibly important. People at the center is everything, and that has to mean that we are really understanding, including and listening to people with lived experience of obesity and what they need, and sustainable organizations and networks, just like we're seeing, and we will be having a MENA association launching. And one last thing, in September of 2025, there will be another United Nations high-level meeting on non-communicable diseases. It's at the time of the UN General Assembly, so heads of state. We very much want to make sure that what's sitting across the risk factors and the diseases is overweight and obesity, and understanding that it is right at the center, and we're going to be having lots of messaging around that. So thank you very much. It's a great pleasure to be here.